the MediNail Pain Patch ProTech program for the general public by Dr. Robert Spaulding and Dr. David Velarde. Disclaimer: LifeWave and MediNail does not treat specific diseases, nor do we create patch protocols designed to treat any specific condition. You cannot diagnose unless you are a medical professional. As per LifeWave's disclaimer below, please always consult with your physician or other qualified healthcare providers before embarking on a new treatment, and do not disregard any medical advice. Please consult your own physician or appropriate health provider about the application of any opinions, recommendations with respect to your own symptoms or medical conditions, as those diseases commonly present with variable signs and symptoms. MediNails assumes no liabilities or responsibility for any damage or injury to persons or property arising from any use of the product, information, idea, or instruction contained in the materials provided to you. LifeWave and MediNail reserves the right to change or discontinue at any time any aspect or feature containing our information. Attention, this is important. Everything we demonstrate today is important. You tell your client to coordinate any patch application with their treating doctor to be sure the underlying cause is identified, treated, and monitored by a health professional. Remember, the MediNail Pain Patch ProTech program is for the general public to be able to self-control pain. The MediNail Pain Patch program is also brought to you by Dr. Velarde, founder of Stargate Clinics, which is a new type of non-medicated pain clinic. The patches used by MediNail in this presentation are made by LifeWave, the icewave and the X39. What is icewave made by LifeWave? LifeWave's icewave patch product combines ancient acupuncture with a remarkable breakthrough technology patch. Your body produces heat and light, which stimulates the patch compounds to vibrate at a microfrequency that activates various molecules that are already in your body. The patch has simple amino acid crystals, salt crystals, and ionized water. One of these molecules found in your body is copper tripeptides. Copper tripeptide activation produces endorphin responses that temporarily control pain. Icewave also interrupts traveling pain signals to the brain. Reportedly, LifeWave X39 stimulates stem cells for cellular repair. David Schmidt, the CEO of LifeWave, which started the company in 2004, based it off of multiple contracts with the Navy and General Dynamics for survival gear, with 94 patents from the years 1990 to 2000. There was a little interruption with 9/11, but some interesting facts are common Navy SEAL injuries. Highest rate is knees. Next is ankles, then foot, and then sprains and strains. You can get this information off of this website on the top that you can go to pull this PDF and look at it in detail. And there's also a good video on him talking to a former SEAL about all this background that he had in developing this for the SEALs. What is acupuncture? Acupuncture uses the body's meridians to control pain. Meridians are superficial dermal nerve pathways, also called dermatones. Here are some examples of meridians and dermatones found on the feet. The difference of reflexology versus acupuncture is reflexology has specific points on the foot's plantar surface and on the top that will activate other organ systems in the body, as opposed to acupuncture that uses meridians. So why did Dr. Spaulding bring LifeWave to MediNails? After being in practice for 26 years, I have never seen an OTC, non-medicated, non-transdermal product like icewave that has so many positive benefits with no major risk factors that anyone with some basic knowledge can apply. Because icewave has impressed me so much and demonstrates such positive pain responses on so many levels without risk, I cannot, as a physician, duplicate the effect. The fact that LifeWave's icewave has been on the market for 21 years shocks me that I have never heard about the immense value of the LifeWave products. I had to share this with everyone in the MediNail program and develop specific training for the foot. I share this remarkable product with everyone I meet to let them experience the icewave wow factor. This MediNail specific lecture briefly covers icewave product education as it relates to the lower extremity as opposed to the entire body. Icewave is a temporary means to control pain and discomfort and is not a cure for the underlying causes. What is a very common topic that goes on daily with your friends and family? Well, you talk about medical conditions like arthritis, old injuries that can cause pain in the back, neck, hip, knee, hands, and feet. When someone comes to me or another doctor with pain, many times I give trigger point injections or prescriptions. How would you like to offer some real potential relief to your friends, family, or clients with foot, hand, or body pain without injections or prescription medical products? For those who have taken the MediNail Advanced Nail Technicians, Medical Nail Technicians, the CCPMA, or the Foot Care Nurse programs, you will recall the following foot problems. Here are some areas of foot pain you may see, like bunions, like arthritis, like plantar fasciitis. And if you look at the rest of them, you may also be familiar with some of the other terms. The top 10 foot conditions, and there are a lot more, are heel pain, neuropathy, metatarsalgia, arthritis of any foot joint, tendonitis, capsulitis, sprains of the ligaments such as the anterior-tibiofibular ligament, biomechanical deformities like bunions and hammer toes, Morton's neuroma, stress fracture pain, and trauma with bruising or lesions like IPKs, porokeratosis, and warts, but not suspicious lesions. Our focus today will be on 5 foot and hand conditions, and we're going to start with the feet: heel pain, neuropathy, metatarsalgia, sprains, and arthritic joints and bunions. Number 1, heel pain or plantar fasciitis, also called heel spur syndrome, is where 50% of the U.S. population may have heel spurs visible on x-ray, but not 50% of those people have heel pain. Number 2, neuropathy pain, sensation of burning, pin, prick, or tingling, not just lack of sensation. Number 3, metatarsalgia, which is pain in the metatarsal heads. Number 4 is going to include arthritic joints, bunions, calluses, and fissures. The last one, number 5, are chronic sprains. These are not acute, but with previous x-ray to rule out fractures. There's about 25,000 sprains every day in the U.S. 30% of those ankle sprains will still have pain 1 year later. So how do we start with patching? Well, first we gently find the trigger point pain, which could be in any of these areas. Next, we want to open your icewave product sleeves and get out a tan and a white patch. Instructions: you will find the tan or brown and white patches. You place one tan or brown patch on or near the point of pain and one white patch on the dermatome or meridian of the body, using any 2 locations at a time. You apply the patches to clean, dry, undamaged skin. Another way to think of this: consider the tan as the negative point that goes on the pain point, and the white, which is positive and circles near the tan patch or the opposite side of the body. So remember, the tan or brown patch goes on the trigger point where you can depress and feel, and the patient will tell you or client will tell you that that is the point of pain. And the white patch goes in a circle an inch or two away from that area as one method as to find the point of pain relief. So again, number one, find the trigger point pain and apply the tan patch directly on that spot. Number two, rotate the white patch in an expanding manner in a circle around until you find the best point of the contact that gives relief. And you can expand or the width of the circle with the white patch again for the best spot for pain relief. So here is an example with met pain or metatarsalgia, pain from a callus underneath the third metatarsal. And you mark that spot, and you also find the trigger point that makes that the most painful, and you apply the tan patch. Again, with the met pain from a callus or other area that you might have pain as a result in the head of the metatarsal, you put the brown patch. And again, you move the white patch in a manner, usually in a circle, and you can expand this circle and go to other areas of the foot to give you the best secondary relief of pain. Here is another example with heel pain. First, you locate the point of the most heel pain with your depressing your finger or thumb. Then you apply the tan patch, and then you rotate the white patch until you find the best relief of pain. This is a picture by Dr. Velarde showing a Band-Aid holding the patches in place that you can reuse these patches as you're finding for the trigger point and the pain relief points. So this is a good way of saving the patches without having to actually pull the stickers off. You can just reuse them as your test samples. Here's an example of the third metacarpal right at the head of that metacarpal. You find the trigger point pain and put the tan patch, and with the white patch you move it in a circle until you find the best relief of pain. Here's another example of metatarsalgia, but it's on the top of the foot. When you press down on the top of the head of the metatarsal, that's where you would put your brown patch. And then the second patch, or the white patch, would go in a circle until you get some pain relief. And then you apply it. Here is another example of patching the third submet, or the metatarsal, under the third toe. Right where the digit connects to the head of the metatarsal, you put the brown patch. And instead of moving it in a circle, you take the white patch and put it in the exact opposite position. One goes on the bottom where the pain is, and the white one goes on directly on the top of that third metatarsal. Sometimes that's the best way to get pain relief. Here are three different options on how to treat neuropathy. The first one, where you're getting all the toes that are involved in tingling or burning, you put the central patch where the central area of that burning and tingling, you put your brown patch. You move that white patch in a circle. Or you can put the other patch, one patch on the bottom and one patch on the top, and see if that gives relief. And then there is a third method for neuropathy. Put one brown patch on the forefoot where you're getting the most neuropathy, and the second white patch in the sinus tarsi, which is in this location right there where the ATF ligament typically is. Here is a male patient who came in with metatarsal pain from a callus on the bottom of his foot at the third submet area, and it was secondary to having multiple hammer toes. And we put the brown patch on the callus, and we put the white patch on top of the foot in the same area on the third metatarsal, and he got immediate relief of pain. Here's a lady that came in with an interdigital corn on her third toe on the medial aspect of the third digit. We put in a toe spacer, but for treating the pain, we put a brown patch right behind the digit and a white patch in the sinus tarsi and got immediate relief. Dr. Velarde's patient encounter for heel pain on 5/2/25 with icewave patches. He used 3 patches,
So
2
you hurt right here.
icewave and 1
Right.
X39,
Say it
or
loud.
you can use an
Yes.
ion for complete
Right, so
relief.
that-
Here is the encounter.
So that's, I'm gonna make sure it's the worst spot. Here or here?
Oh,
Right there.
Oh, yeah.
Okay.
Yeah.
So you put the brown patch where it hurts the most.
Okay.
Okay. You take the white patch.
Okay.
You don't take the backing off.
Okay.
So I'm gonna place it here. Tell me that hurts.
No.
I'm pushing hard like I did before, right? I take it off. Hurt?
Yeah.
It doesn't?
Yeah.
Doesn't hurt?
I mean, I can still feel a little bit, but it doesn't hurt like, yeah.
What about right here?
Yeah.
Still hurts?
Yeah.
Here?
No.
No pain?
Yeah. No.
Okay, you can stop.
Dr. Velarde on 4/4/25, patching one
All right, so
knee
get
of
up.
an obese female patient
It's
with
not
knee
gonna hurt.
pain and walking with a cane.
How's that feel?
Oh yeah. I could tell the difference. Mm-hmm.
Tell the difference?
Yeah. Feels good. I didn't know you could do that. But you see how this and
Here is the same obese patient walking with both knees patched.
Now we patched both knees.
now see how much better I walk even without my cane. Ooh, that is so cool.
Right now they're burning your neuropathy, right?
Yes.
And how long has it been bothering you?
This time about 2 weeks, but the last 2 days, and last night I slept none. Last night hardly at all. It kept waking me up, and I kept rubbing that stuff on there, and it helped for a few minutes, and then it'd start again, and it's just driving me crazy.
Okay, now tell me if you feel anything now.
Yes, I do.
Feel something on the foot?
I do. It's just throbbing.
What's it feel like now with the patch? Can you feel a difference?
Now maybe it's my imagination, but no, yeah. It comes and goes, and I want to just.
Well, what's it? Is it helping? Can you tell a difference between one foot and the other?
Yeah, I tell a difference in one foot and the other, but it's still throbbing, but not as bad as this one is. Not like it was. It's not hurting like it did before.
So the only difference with this one is I placed,
The left one is worse than the right one.
but does it feel better now?
It does feel better, but there's still a tingling.
Right, but the pain.
The pain's not like it was. No.
Okay, so you're better on that. It's been on for 10 minutes?
I guess.
And it feels,
Oh, I don't feel any pain right now. I could jump. I think I'll dance.
You like that better?
so
Like
it's,
that better than this?
Well, I want that too.
Yeah, I know.
but you can tell a difference on
Oh,
both
yeah, the
already.
big difference. Then when I walked in here, big
She's
difference.
taking the last 2.
That's
I
fine.
saved them for her.
All right, so how long have you had the neuropathy pain?
Since I was 21 when I was diagnosed as diabetic.
Okay, so you hurt walking, so
Yeah.
I didn't put one on the other foot so you can compare. So go ahead and get up and
Yeah, that feels a lot better. Feels a lot
A
better.
lot better. Okay. So that's for gout, and it does feel better, right?
Yes,
Try moving, try walking a little bit just to tell the difference.
I can tell the difference already. I couldn't hurt. It still hurt when I walked on it. Shoot, it's better. I could dance on it.
If you still do not get relief, add the Ion or the X39 to the icewave patch. Ion helps reduce inflammation. It's great for arthritis. Key points for patch placement. Most reasons that you don't get immediate patient relief is not taking the time to properly find a meridian that works. Sometimes you must place the white patch even on the other side of the extremity or opposite side of the body to see relief. Do not patch open wounds, ulcers, fractures, or draining areas or infections. You need to refer these on to the doctor immediately should they come in your office. Do not provide services to these individuals. Here are some more examples of whether you patch or refer or both. In most of these cases, especially the first one, that can actually be a melanoma if you don't have a history of bruising. These other ones have open wounds and or severe biomechanical problems that's going to need a podiatrist to address. The following information is very important to remember. Cautions with LifeWave products. Remove immediately if you feel discomfort or skin irritation occurs. Do not use or reuse patches once removed from the skin. If you have a contact allergy, that's something significant to adhesives that you need to be aware of. Do not use on wounds or damaged skin. It's for external use only. Do not ingest. Ask a health professional before using if you have a health condition, any questions or concerns about your health. Do not use if nursing or pregnant, and not intended for use on children. Do not apply used patches other than directed. And the product needs to be stored at room temperature. LifeWave products may activate at 80 degrees and above. Do not leave in a hot car, direct sunshine, or your inner clothing pockets, or allow sources of heat to come in contact with patches or LifeWave sleeves containing the patches. Icewave patches, expansion of applications. Patches can be used almost on any area of the body. Patches can be worn up to 12 hours before discarding. Keep well hydrated while using this product. Only remove half of the patch backing until an effective placement site is located. You can also use tape to tape them in place until you find the right area. Once you find the trigger point pain, moving the white one around and using tape or just pressing it with your thumb until you find the area of best pain relief. These pain patches can be applied almost anywhere in the body for pain relief. Look at the following slides to show and read how to apply these on the other areas, backs, necks, even for headaches. Here's some additional information and locations for getting knee pain relief. Here are some placements for headaches and hands and shoulders. Here is some additional information for neck and shoulder applications. The results of icewave patching. Some people get immediate relief. Some take hours or days. It may lead to self-administration where someone else learns how to control the meridians better and move the patches to control pain. It may lead to excellent financial supplement for your family. It may lead to helping anyone with other body aches and pains. It may lead to increased referrals for your services. It may lead to anyone not having to depend on as much medication as often. It may lead to helpful LifeWave patch products that may improve overall health. Anyone can become a brand partner if they decide to obtain their products at a better cost advantage, and anyone can introduce icewave to their friends and family. You can expand into 10 other LifeWave products that can help overall health that we haven't talked about yet. The difference between the icewave and the LifeWave X39: icewave is more for temporary relief of pain. LifeWave X39 has other long-term positive benefits that you need just a complete education just on that product alone. You are now a certified MediNail Pain Patch ProTech on icewave products. Once you finish our MediNail Professional Patch program with all the other LifeWave products, you can be certified as a MediNail Pain Patch Professional. So let's start patching. This is the only way you're going to get trained and educate yourself on how to apply these patches. For information on how to sign up for the LifeWave icewave MediNail Pain Patch ProTech program, go to these links below: Dr. Spalding at lifewave.com/Dr. Spalding and Dr. Velarde at lifewave.com/Stargate Clinic. Or you can call them at the numbers listed, or Cheryl Morgan at cherylmorgan59@gmail.com.